I would have asked you something about histology. You know, got it really exciting from the start, but I actually want to talk a little bit about COVID-19 and the coronavirus and the situation we're in at the moment.
Sure.
How are you going?
So we're going okay. So to give context to people that may be listening, this comes the day after level 3 guidelines national
Yeah.
across Australia has been advised. So that basically means that general dental practice and specialist dental practice is not the way that we know it as usual, and it
Mm.
might be. And I think one of the most difficult things at the moment is that nobody knows how long this will last for. Everyone's making educated guesses. 3 months, could it be longer? Could it be shorter? One thing that I'm very aware of, looking at some of the things that my friends and people that I'm close to are saying, is what they're going to do about their staff, the HR issues.
Mm.
So I can definitely feel that there is a lot of anxiety and a lot of stress in the community at the moment. It is a difficult time. I
Mm.
have no doubt that we will get through this. I mean, dentistry is an essential need. People will come back. But at the moment, I am very happy and proud of the fact that a lot of dentists are doing what we need to do to flatten the curve, stay home, donate personal protective equipment if needed. So many dentists in WA that I know of have actually put their hands up to help if more
Mhm.
healthcare workers are needed. So all of that is very beautiful things. Most staff are being quite understanding. So I think one of the things that I've noticed about Australians, and in the bushfire crises as well throughout the years, in times of need, so many people really do
Mm.
stand up and put their names forth and try to help where possible. So I think that's one of the really big positives to focus on at the moment.
Yeah, I completely agree. Australians tend to step up in times of need, and I think we're all a pretty level-headed bunch. But it is a scary time for a lot of people, both dental students, graduates,
Of
our
course.
staff, practice owners, and everyone.
Of
You've raised a
course.
really good point. The ADA WA are organising to have some PPE donated to hospitals, and some dentists are putting their hands up to help in certain situations outside of dentistry. Can you tell me a bit more about that?
Yes. So at the moment, all of this is an evolving situation because it's only really in the last few days. Because
Yeah.
I remember before, so like we can think of it as like pre-COVID and after COVID. Pre-COVID, things would move at a slower pace. All of a sudden now we're having to turn around things in hours. Like a day is too long.
Yeah.
So all of this is evolving fairly quickly. And PPE and all the things that we're doing is our focus, but at the same time, we're also trying to help practices through in the level 3 guidelines that were just passed last night. So what we're doing at the moment, and I must admit that when we first thought about asking dentists to donate PPE, we weren't sure of the response because the big headline news for months before this was the fact that people were going to run out of masks, and dentists
Mm.
were panicking, having to buy masks at higher than normal prices. But we've been absolutely blown away by how many people have reached out wanting to donate their stock to the hospitals. So from what I'm aware, the CEO and president of ADAWA have reached out to the various health departments. We are collecting the PPE at ADA House.
Mm.
And then we are also organizing couriers or people to pick up the equipment or the stock from the practices, and then we're going to drop it off at the health departments where it's needed. We're also keeping a list of people who have put their hands up to want to help. So whether it's going to be at the hospitals or in clinics, one of the things that we are focused on is that if they are going to be working in these centers to treat COVID positive patients, that they do have appropriate equipment and protective gear. So at the moment, we're keeping a list of people who are interested. The government hasn't actually made the call yet that they do need dentists to come to the
Mm.
forefront. But if they are, we do have a list of volunteers ready.
Yeah, I think that's it's an amazing thing that everyone's putting their hands up and realizing the need, and we are a trained force that can step into that role in some way. Of course, some people will be listening to this thinking, "Wow, COVID was a long time ago." I hope in the future people are listening saying that.
I hope
It's
so. I
it's
hope so.
today's the 27th of March, 2020. So I think that gives a little bit of context, but obviously this will evolve over time. I do want to just get a little bit more information from you. Of course, you're all medicine specialists, so a little bit more
Mm.
understanding of viruses and the situation we're in. Can you tell us about why this is such a big concern?
Yes. So the main reason about this, why COVID is a big problem, is how transmissible and infectious it actually is. It's at the moment, when you think about a virus and how quickly it spreads between patients or people, there's a number that's called an RO number. So how many people can one person actually infect? So when we think about the previous the previous viruses that have caused epidemics like SARS and MERS, they were more deadly at that stage, but they were also not transmitting as quickly. Because this is a novel coronavirus, so it's zoonotic, so it's moved from animals to humans, that means that the virus has the ability to mutate and mutate quite quickly. And because it's novel, it's something that we've not experienced before in humans, we don't have any immunity against it. Whereas if you think about the influenza virus, for example, we do have partial immunity against it. We have no vaccinations against it. That is something that will probably take months. It will probably come out next year, hopefully sooner. So it's just this big combination of factors that's making it spread very quickly. We don't really have any control over how quickly it's spreading. And I feel like we don't have accurate numbers as well about how many people actually are infected.
Yeah.
I mean, according to government figures, we know that community transmission maybe started several days ago, but in reality, it's probably been around longer, and these people are just not being tested. That's the other thing.
Yeah.
And I think the final one that's quite worrying is, are our healthcare systems set up for it? So in the 5% of patients that do get very sick from this condition, 5% doesn't sound a lot, but if you think about it in actual numbers, are our hospital systems set up for this? Do we have enough ventilators? And I think that the final bit that is on everyone's mind is that, based on some of the studies and the reports coming out from Italy and China, the healthcare workers that get sick, so the people at the forefront, do tend to get more seriously ill as well. So that's the other thing.
Why
So
is
like,
that?
don't know. So for example, ENT surgeons, people who are in very close contact with these patients, if they do tend to get it, these are young, healthy individuals, but there seems to be a higher proportion of them needing, ventilators, being in ICU, or not recovering at all.
Yeah. Okay. That's a scary concept, and it's something that's important for us to understand. Is there a message you'd want to share with dentists at this time about what we should be doing, what we can be thinking about? I'm thinking also around it's very virulent, it's very infectious, and one of the things is it's droplet, it's contact, but it's also airborne. Considering the guidelines we're in now, what should we really be thinking about, and how serious should we be taking it?
Yeah. So as far as I'm aware, keeping abreast of as much as I can during this time, droplet transmission, definitely. Contact transmission, yes, is the same as droplet transmission. I think the fact that it's airborne is something that has been reported in the most recent studies. I don't know if that is absolutely proven without a doubt yet, but I think, as far as possible, listening to the guidelines, staying at home as much as possible. If you don't have to go to work, if you can take your kids out of school, take your kids out of school. I think social isolation will be a big one. I know hand hygiene is absolutely critical, because if there's droplet, if somebody has sneezed and they've sneezed onto a surface, and it can live on the surface for hours, and you touch your surface and then you self-inoculate, you touch your eyes, your nose, or your mouth, it's quite important to try and stop that where possible. So hand hygiene is something that is so simple. And I think because it's so simple, that people have underestimated it, because I remember in the middle of all of this, everyone was buying masks. Non-medical people as well. And I was telling people around me, like, don't buy masks, just make sure that you wash your hands really well, because that will be the number one measure. And they looked at me like I was suggesting something so simple that it couldn't possibly be true. So I think making sure that you are washing your hands for long enough, making sure you're washing every surface possible of your hands, I think that's very important. In terms of dentistry wise, stopping all aerosol generating procedures, I think, is absolutely critical. I think swabbing surfaces, asking your patients questions to try and reduce the chances of them having been overseas. Although, as I said, now with community transmission becoming higher and higher, I feel that whether they've been overseas or not doesn't necessarily mean that they're clear. I think dentists are very much doing a public service by treating emergency only cases that cannot be deferred. But for anything else, I think in the interest of your own health, the health of your other patients, and the health of your staff, I would try to defer as much as possible, because one of the big things about this situation is that it's all an evolving story and new information is coming like all the
Yeah.
time.
Yeah, absolutely. And that's the thing. The key thing is when we're talking now is important in the context of this. Can I ask a question? Hand washing is extremely important. And I think as dentists, we should know that, but sometimes we do need to be reminded. What
Yes.
about our clothing that we wear in the clinic and things like that?
Yes. So what I'm doing at the moment myself personally, so I think that the thing to keep in mind as well, for people that are listening, is that if you've been reading the ADA guidelines and ADA infection control booklets and things like that, that is the bare minimum. So
Mm,
if you want to do more, there is absolutely no reason why you shouldn't and why you can't. So if level 3 is not something that you yourself personally are comfortable practicing at, go up a level, go up to level 4.
mm,
So
mm,
that's the one thing. So if, in terms of PPE, in terms of clothing, I wear scrubs and then I wear a disposable gown over the top
mhm.
for each patient. And this is from oral medicine, which is not necessarily an aerosol generating practice. But the other thing to keep in mind is that I do have pretty bad asthma myself, so I am being quite cautious.
Okay, yeah, which is a really important point. If people do have comorbidities as well, they have to be thinking deeply about this.
Definitely.
Hmm. Well, thank you for sharing that that stuff on COVID and coronavirus, a very pressing topic right now.
Mm.
But of course, I want to know a lot more about you. I want to know how you got into oral medicine and learn some tips and some information for the dentists and graduates. Tell us, was oral medicine always going to be your path?